the most common thing we deal with as dancers. Anything from a little niggle after class to, oh, I really kind of tore my hamstring with that kick. This video is going to give us just an overview of general muscle injuries, what goes on when they get injured, what sort of things cause the injuries or lead us down the path to damaging our muscles, what to do when we get injuries to our muscles, and how best to take care of them. But look out for specific videos on particular muscle injuries where I can be more specific. This is going to be quite general. But let's look first at how we label our muscle injuries, because there's lots of different names for them. You might have heard of a torn muscle, a muscle strain, a muscle rupture. Really, these are all describing the same process that's happened in a muscle. Whenever you damage a muscle, be it just that little niggle after class to a more significant injury, you have torn some of the fibres to some extent. Remember that muscles are made up of long strands of fibre, a bit like strands of hair. And when we damage a muscle, we actually kind of break some of those fibres, a bit like they've frayed a little bit. That might be at a tiny microscopic level, or it might involve many more fibres of the muscle. Any sort of exercise really induces a level of tearing of the muscles. We kind of push them a little bit beyond their allowable range in order to improve strength. And we call that exercise-induced muscle soreness. But when we're actually damaging the muscle fibres in a more significant way, we start to term that more as an injury. Now that tearing, as I say, could be microscopic and it could be the full thickness of the muscle. And we tend to put these into categories called degrees of tearing. A first degree muscle tear would be less than 10% of the fibres torn. This is those kind of, oh, I kind of tweaked my muscle, it feels a bit sore, but it's not particularly altering the function of that muscle. You're still able to work around it. A second degree tear, we're getting more significant number of the fibres being involved, anywhere from 10 to 50% of the fibres of any given muscle. So this one you're going to really start to feel the soreness is actually going to restrict potentially the flexibility of that muscle and even the power of that muscle. You're going to be aware of it for a longer period of time. A third degree is a really significant injury. You're looking at anywhere from 50 to 100% of the fibres torn. And when it's 100% of the fibres torn, we call that a rupture, where the muscle has literally come apart. Now, don't panic. It's very rare for this to happen. I've probably only seen a couple of true full ruptures of muscles in dancers over all the years I've been doing this. And in both cases, neither of them actually happened in the dance class. They were injuries that happened in other accidents outside the dance studio. So it's very rare as dancers for us to put that level of damage through our muscles. But we'll look at what is actually happening when these muscle injuries occur. Now, with any muscle tearing, you're going to get a degree of bleeding happening, right? Because muscles are richly served with blood, and therefore when the fibres are torn, you're also damaging the blood vessels that bring the blood to the muscle, and you're going to get bleeding. So let's have a look at that injury process. You can liken this to when you get a cut on your skin. When you cut the skin, you've torn the fibres that make up your skin. It's going to bleed because of the blood vessels in the area. But remember that the inflammation that then ensues, so wherever we've got a tear in our body tissues, inflammation is going to accumulate there, and that's going to bring the healing ingredients to fix that muscle. Go and check out the video on inflammation to learn more about what's going on when we get these sorts of soft tissue injuries. But you'll notice the area gets hot and swollen, just like it would on your skin. The area of the muscle that's damaged Often you can feel it with your hands. If you run your hand over that area, the spot that's been damaged may be warmer than the surrounding tissue. Or if you compare, say, the quad on your right leg to the quad on your left leg, it's like, oh, that right one's kind of got quite warm and hot. It tells you there's inflammation going on. And sometimes it'll even swell up. You'll notice if you cut your skin, it becomes a little bump forms. Same thing in the muscle. If it's very deep in the muscle, you might not notice it. If it's nearer the surface or if it's quite significant, you might actually be able to see or feel that swelling. Now, what's going to happen when those fibres have been torn is they're going to start to get bound together. Exactly the same as when you cut your skin, you're going to get a scab formation. In a muscle, we call this an adhesion, like adhesive, because it's sticky, right? It's a sticky substance that's going to come in and patch up that leaky spot in the muscle, and it binds those broken fibres together. But as it starts doing that, just like a scab, it's a little bit irregular. It's kind of like a quick patch that the body's put in there. And just like a scab, it doesn't behave like the surrounding tissue. You'll notice your skin is normally quite stretchy and mobile, but where you've got a scab around it, it's quite tough and thick and almost brittle. That can also happen in the muscle as it's healing, and typically this is what people refer to as a knot. I always kind of cringe when people say, I've got a knot in my muscle. You're not really tying knots in your muscle fibres. What you're feeling when you feel those bumps in the muscle or those little sore spots in the muscle is the formation of that adhesion. So that's really what's going on when you're feeling that little sticky or harder patch in your muscle tissue. The level of pain you experience is really going to be dependent upon how many of those fibres are torn. Are you in that 1st degree or 2nd degree bracket? If you've got a 3rd degree or a very significant 2nd degree tear, then you might even notice bruising. You bleeding inside, right? Because those muscle fibres have torn. If there's a lot of blood, then it'll actually rise up towards the skin and appear as a bruise. But typically this can take a few days to appear. So you might not see it straight away. And then a few days later, you might look and think, what on earth did I do to my leg to cause that bruise? Because you're often thinking you've walked into something or bumped it externally. But as the blood cells that have been involved in that internal bleeding die off, they start to get pushed to the surface and they'll appear as a bruise. So often you'll see a bruise show up a couple of days later. And again, if you've got really significant damage to the muscle or if it's completely torn, you're going to lose function in it. It won't just be sore and stiff, it'll actually not fire up. You'll lose power in it, or it just won't act in the way that it should. If you've got a significant damage to a muscle, you really should go and get it checked out by a healthcare provider, and they can put it through a range of tests and actually detect exactly how damaged that muscle is by how much function has been lost from the muscle. But that's really the sort of process that's going on when you've injured the muscle. Another form of soreness that we get in our muscle is something called the DOMS. Have you ever heard of that? But it stands for delayed onset muscle soreness. How often have you done a really heavy class or performance and then you kind of feel okay afterwards? You go to bed, you wake up the next morning and you can't stand up. You're like, oh, I feel so stiff and sore. So this is pain and stiffness that occurs typically about 24 hours after the exercise that caused it. So this is that delayed onset muscle soreness, very typical. The muscles often feel distended, almost bloated. If you prod them with your fingers, they feel hardened and thickened rather than soft and compliant as they would normally be. This is due to a build-up of that inflammatory waste. So remember, if you've worked the muscle really hard, you will have induced a bit of that muscle tearing. You're going to get that bleeding and inflammation. One of those inflammatory chemicals is called lactic acid. It's the one that a lot of people have heard of. If you allow the accumulation of those waste products like lactic acid after exercise and you don't clean them out, then they remain latent in the muscle, and then you go to bed and they sit there, they're not being pumped out. Remember, the drainage vessels for draining the waste out of your muscles run through the muscle tissue. So if those muscles were really tight after your exercise that day and you didn't do anything to reduce that tightness and stiffness, i.e. stretching, which we'll come on to, then those waste products just sit there, and then they actually irritate the nerve endings in the muscle, but it kind of takes time overnight. Obviously, when you're resting, sleeping, not moving, your circulation dies down, so it's not flushing and cleaning out the area. So you're getting this build-up of inflammatory waste that starts to irritate the nerve endings, and then when you go to get up in the morning, you've got all this inflammation going on in the muscle tissue. So this is why it's really key to stretch out, ideally after exercise, after your last class of the day or your last performance of the day. If you don't have time to do it then, I always get that excuse from dancers, I never have time, I've got to rush off at the end. Do it before you go to bed. So warm the muscles up again, warm bath, warm shower, and then stretch out before you go to bed. Then you're cleaning out, you're kind of milking out that waste product buildup so that you're not carrying it into the next day. As we'll see, one of the risks for injury is previous day's baggage being carried into the next day. So whatever you've dealt with today, clean it out of the system. Otherwise, you're just building and building day on day, and then eventually something's going to go pop. Massaging is also really useful, either getting a massage from a practitioner or just self-massage. And I'll do some videos on some self-massage techniques. But if, say, those calf muscles are sore after exercise, you did loads of jumps that day, stroking up and massaging those muscles and can really help to milk out and clean away some of those waste products. Always work towards your heart when you're doing that. So if you're working on your calf muscles, for instance, you want the strokes to be upwards towards the top of the body. If you're pushing things downwards, you're actually pushing those waste products down into the feet, and then your circulatory system's got to work quite hard to pump them out again. You want to work upwards so that gravity is not pulling those waste products downwards. So that's just a little tip, but I'll do some specific videos on self-massage techniques. Let's look at some of the causes of injury. Now, typically, injuries to muscles occur because of overloading, i.e. you put more force through that muscle than it was strong enough to withstand, or overstretching. You pushed it to a range of motion that it didn't have enough elastic compliance to be able to absorb. Remember, muscles are elastic, they can contract and they can stretch, but they do have limits at which, if we put too much of a stretch through, we can damage some of the fibers. Often that can be because the muscles are cold. So you might find that you're used to kicking your leg to a certain height, but on a particular day it didn't like it because it wasn't warm enough. Remember, the blood coming into the muscle warms it up and makes it softer and more compliant, more elastic, and more able to stretch. So insufficient warm-up is a big risk factor for injury. Remember, your warm-ups need to be about getting blood flow into your muscles, not about stretching. I'll do a whole video on warm-up, because just stretching the muscles out, can increase your risk of injury if you stretch before exercise. Watch the stretching series of videos to find out why. But also it's kind of squeezing the blood out rather than bringing it in. So really we want to get our hands in there and rub the muscles, get the blood flow in so that they're ready for whatever load or stretch we're going to put through them. Excessive muscle tension. This kind of comes back to a bit of what we were talking about with DOMs. If those muscles are tight because of something you did the day before, then again, they're less compliant. They're going to be more prone to tearing if you put too much force or stretch through them. Muscle imbalances is another issue. You'd be familiar, if you've watched the Meet Your Soft Tissues video, you'll be familiar that muscles work in pairs. So if, for instance, your quads and your hamstrings are a paired group, if the quads are stronger than the hams or vice versa, we've got an imbalance there. That can lead us down the path to potential injury. But also within those muscle groups, your quads are made up of 4 muscles, your hamstrings are made up of 3 muscles. Check out the hip video for more on the specifics of those muscles. If you've got imbalances between any of those individual muscle bellies that make up one group, you can get discrepancies that can lead you to injury issues. And then also alignment. Are we using those muscles in the direction of their fibre alignment? Remember, they're like strands of hair, the muscle fibres, and if you load them along the line of those fibres, they can be very strong and take a lot of load. But if you put a force that comes through across those fibres, because you're, say, landing from a jump and your knees aren't over your toes, and you're getting a shearing force through that muscle tissue, again, it's going to be more prone to injury. Overuse, fatigue. How often do we get tired, either within a class or performance? Towards the end of it, you're starting to get more tired, and that's often where we're doing the stuff that takes the most load, right? If you're doing the big jumps at the end of class, the more ballistic stuff, and you're most tired, you're more prone to injury, which is why we need to look at our cardiovascular fitness, make sure that we've got enough energy in the tank to keep us going towards the end of the class or performance where we're typically doing the most vigorous exercise. Overuse as well. If you've overused that muscle and that's leading to its fatigue, you're more prone to injury. And then one of the most common ones, previous injury with inadequate rehabilitation. If you had a lot of little micro tears in those muscles that have built up over time and you didn't get them massaged out, you didn't stretch them out after injury, then you can lead yourself down the garden path to further injury. Quite often when I'm treating someone's calf muscles, a dancer who's been around for a while, I'll pick up on little pockets of scar tissue, unrehabilitated old injuries in those muscles that have now reduced the overall elasticity and power of that muscle. Therefore, it's more prone to another injury. So take care of the small stuff, then it doesn't have to become the big stuff. Another risk factor for injury, or the time at which muscles are most prone to injury, is through a phase called eccentric loading. Check out the Meet Your Soft Tissues video where I go into this in more detail. But essentially, muscles can contract and shorten. And typically we tend to think that when they stretch, they just lengthen. But it's not quite as simple as that. If we take that example at the top there of the biceps and triceps, another paired group, when you lift something heavy up, your biceps is contracting and shortening and your triceps is lengthening on the back of the arm. But when we put something down that's heavy, that's got a load on it, the triceps is contracting because that's the muscle that straightens out your elbow. The biceps does have to release to allow for that movement, but it's not just going to let go. Otherwise you drop the thing. So what happens is, as it's lengthening, it's also contracting to provide a deceleration force. So this is controlling the rate of descent. Therefore, that muscle is doing two things at once, both contracting and its fibres are being pulled apart. This is called an eccentric load. This is the most vulnerable time for muscle injury because it's when the most force is going on. It's kind of the most powerful thing a muscle has to do. An example of that for us as dancers is landing from a jump. Your calf muscles, as you land from that jump, they're being stretched because you're going into that plie position, but they're also contracting to control your rate of descent. If they didn't do that, you just end up in a heap on the floor. You've also, when you're landing from a jump, you've got anywhere up to 8 times your body weight coming down with force through those muscles whilst they're in an eccentric load. Maybe now you can start to see how this is quite a vulnerable time for those muscle fibers. If those muscles are not trained to be strong enough to take that load, then they're prone to injury. Muscles that are also most prone to injury are what we call two-joint muscles. These are muscles that cross 2 joints. Some muscles just cross 1 joint in the body, others cross 2. Our calf muscles, for instance, well, the outer layer of our calf muscles, check out the ankle video to learn more, but the outer layer, known as the gastrocnemius muscle, crosses both your ankle joint and your knee joint, so it's a 2-joint muscle. The hamstrings, the quads, are crossing both the knee joint and the hip joint, 2-joint muscles. There are more vectors involved when you've got 2-joint muscles, therefore there's more play and more opportunity for misalignment and for things to go wrong. As I've talked about, alignment is key. If you're landing from that jump, say, and your foot's rolling in and the force through that muscle is coming across the muscle rather than straight up and down the line of fibers, it's going to increase the risk of injury. Another spot that's really prone to injury in a muscle is where the tendon meets the muscle. Again, watch the Meet Your Soft Tissues video to look at the detail of this, but muscles become tendons so that their force can be transmitted to the bone. And where the tendon fibers blend in and become the muscle fibers, this is a load point because you've got the elastic muscle fibers meeting the much less elastic tendon fibers, and therefore there's a discrepancy in the forces there, and we call this the musculo-tendinous junction, or MTJ for short, and typically that's the spot that's most prone to tearing in that muscle. If you prod into, you see that picture on the right there with the MTJ of your calf muscle meeting your Achilles tendon, which is actually almost halfway up your calf shin area. If you prod into that spot, you'll normally go, ouch. Okay, treatment. What do we do if we injure our muscle? Again, this is going to be specific to particular muscle injuries. So these are just some general principles you can look at. If you've done quite a significant tear to that muscle over and beyond just the, it's a little bit grumbly, niggly, it's going to be in that inflammatory phase where it's healing itself and binding up that injury, really for the first kind of 48 hours. In that area of time, you want to be looking at resting it and icing it. Check out the inflammation video to look at the principles of icing. But in this phase, it can respond quite well to icing, but later on, muscles typically respond better to heat. In the first kind of 10 days of an injury, again, this is general time periods depending on the degree of severity of your muscle injury. But in those first 10 days when it's healing itself up, we want to begin gentle loading and stretching. We actually want to put a little bit of force through the muscle, pull it to its stretch to help it fix itself into a lengthened position. If we just left it and didn't do anything with it, that scab formation, the adhesion we talked about, can end up being short and sticky, and that leads us into that issue of unrehabilitated injury that can predispose that bit of tissue to now be shorter and less powerful than the surrounding tissue, leading us to potential re-injury. In those first 10 days, if you push yourself too far, it's that Goldilocks window, we've got to do a little bit of loading but not too much. If you push it too far, it's that area of adhesion that is weakest and it will re-injure itself. After 10 days, we want to get into more optimal loading, make sure we're tracking those muscles in their correct alignment, building the strength back, building the elasticity back. Again, if you push too hard in this phase, it's actually the surrounding tissue around that healed area. Once after 10 days, that area is getting stronger, but it's still a little bit less stretchy and compliant than the rest of the tissue. And what tends to happen in that window, if you pushed it a bit far, is that surrounding tissue pulls away from that healing area, and that's where you get re-injury occurring. Massage is really, really, really useful during this healing phase. A good massage therapist will pick up on these little adhesions. They'll help to realign those fibers so they get back into their optimal fiber alignment so that they heal and you get that full power and stretch back. And they'll be able to give you more targeted stretches and loading exercises to do. For just a minor muscle injury, you can also do some self-massage techniques, and I'll do videos on that to give you some tools and techniques that you can use on yourself to help not only deal with a muscle issue that's come up, but also to find little ones that haven't necessarily caused you pain but are just lurking in there waiting to cause trouble. We don't often know about everything that's going on in our bodies. Watch the pain videos to learn more about that. But if we get good at working our hands through our muscles, getting to know what's a healthy tissue feel like, what does a tissue with adhesions in it feel like, and then you can build your skill set to be able to treat yourself. We also need to pay attention to balance and proprioception. Proprioception is that ability for the body to know where it is in space and make appropriate adjustments to muscle tension and tone to be able to keep us upright if that's where we want to be. That can get damaged along with muscle fiber damage, so we need to make sure that's part of our retraining process. Stretching and strengthening in combination, also important. Watch the videos on those particular things to be able to get more specifics. Full healing for a muscle damage area can be up to 4 to 6 weeks. It doesn't necessarily mean you'll feel it there. You might be pain-free after a couple of weeks and back to full class, but the tissue is still healing itself. It's not 100% yet, and you still need to be mindful of the fact that it needs to be taken care of. Typical place for re-injury is when the pain goes away. I see it so often. People say, I didn't feel it anymore, so then I suddenly pushed myself to full jumps and then bam, I was injured again. Pain, presence or absence does not tell you whether that tissue is fully healed or not. The pain will go away a long time before the tissue is fully strong enough yet. So you still need to be taking care of it up until that 4 to 6 week window. And always, of course, we've got to address the underlying cause. Why did it go in the first place? Was it because it wasn't strong enough? Was it because it wasn't stretchy enough? Was it because your alignment was a bit off and you were stressing the muscle in a non-aligned manner? Always figure out the why. Don't just treat the what, treat the why. That was just a general overview of what happens when our muscles get injured and what we can do to prevent and manage muscle injuries. Check out specific videos on target areas if you've got a particular problem with a specific muscle, and then we can get into more of the tailored approaches to managing the injuries. But take care of your muscles and they'll take care of you.